Let me give you another piece of advice, if I may. It's my own personal opinion. People tend, especially more from your generation than younger generations, for those of you who are a little older than I am, to deify doctors and to assume that whatever they say, it's right, they know what they're doing. A lot of people don't know what they're doing. A lot of people have practices now with the HMOs. They have 5 minutes to talk to you, and they didn't have the time to ask you an important question which would affect the answer they're going to give you as to what to do. Do not give away your power of reason and thinking to somebody else. Not to your husband, not to your wife, not to your doctor, unless you're mentally ill and you can't think for yourself. If you can think for yourself, then I recommend that you ask your physician, when you're dealing with a serious issue, to explain it to you so that you understand it. And so that this way you can be the ultimate decision maker about your life. This is very, very important. I'll give you just one quick example that came to me from about 18 years ago in my practice, maybe 17 years ago. A woman came to see me to get off of Valium. She was totally addicted. Her father was a doctor. Her mother used to take her father's prescription bag, and she was loaded on drugs all the time, but she would make her own prescriptions. And the daughter got addicted to all kinds of things. She was in her 30s, I believe, when she came to see me. And she says to me, Dr. Sheldon, and she came to see me because she was working on psychological issues. She was already off of Valium. She had some stomach upset. She went to her internist. You know what the internist said? Take some Valium. Okay, it's a true story. Okay. I had a patient in my practice years ago who both his surgeon and his chiropractor said he absolutely needed back surgery. There was no question about it. At that time, I had a health center, which was an interdisciplinary practice. We had a medical doctor, we had an acupuncturist who was actually a cardiologist who decided to go into acupuncture, nutrition, biofeedback, hypnosis, psychotherapy, body work, massage, a variety of people working together in the treatment of people. So what we did with this gentleman is we did some biofeedback, some hypnosis, and some psychological counseling. And I found out that, you know what was wrong with his back? He was carrying his father around on it all his adult life. He came from England, where basically men are taught not to be aware of their emotions too much. And he really had his father on his back. And he got his father off his back, and he actually moved to a more comfortable town, and his back problem went away. Okay. And while I'm saying that, let me say something else. I really recommend that people get second opinions, and sometimes fifth opinions, and take that seriously.